We're going to get started. Welcome, and thank you for joining us for listening to Survivors, how organizations can work with survivors of maternal complications to facilitate effective storytelling. We would also like to say thank you to the Maternal Health Learning and Innovation Center and those who organized this symposium. We are deeply honored to be included among the excellence being featured here at this symposium this year, and we appreciate those attending our sessions for your willingness to come and learn from us. My name is Jessica Montalto, and I've been an advocate for maternal mental health for 6 years after suffering from perinatal mood and anxiety disorders with my first child. I have spoken to audiences from clinicians to patients and families, as well as ran my own support group called Strong as a Mother to help struggling moms. I am currently attending Kane University, working towards my master's degree in clinical mental health, and hope to work as a licensed professional counselor while continuing to advocate for women suffering from PMADs. And this is my partner, Jamie.
Thank you so much, Jess. First, I have to apologize for my voice. I woke up yesterday pretty sick and was scrambling to have a telehealth visit today. So I appreciate you bearing with me while I make my way through this as a very hoarse nurse right now. So thanks, Jess. My name is Jamia Gunsday, and I'm a registered nurse where I work in New Jersey for the Central Jersey Family Health Consortium. In my current role as a nurse abstractor, I tell the stories of women who died during pregnancy, childbirth, or in the postpartum period to experts who attempt to determine what happened and make recommendations to improve the health of all people in New Jersey giving birth. I'm a trained labor and delivery nurse, and before I was a nurse, I served as an advocate for people, mostly women, who had survived victimization, including intimate partner violence, sexual assault, and stalking. As a survivor of intimate partner violence myself, I've also shared my own story to raise awareness. It's through these experiences and identities that Jessica and I join you today. So the first thing we wanted to do is say that we have no conflicts or disclosures. And in order to save my own voice a little bit, I'm going to let you just briefly look at the learning objectives for our talk today. So before we really get started, I wanted to talk a little bit about how the collaboration between Jessica and myself came to be. The session that we're doing today actually came together in a really cool and organic way. I had the pleasure of working with Jess last year to help prepare her for a speaking engagement she was doing for my organization for Maternal Health Awareness Day. It was such a fulfilling experience for both of us that we agreed to work together again. And when we saw that this symposium was looking for examples of innovation and collaborative partnerships, we were excited to pair up to share our experience. So let's get to work and talk about how your organization can pair up with survivors to facilitate effective storytelling. The first thing I wanted to do, I'm going to break it into 4 different sessions. We're going to talk about why organizations should pair up with survivors. Next, I'll discuss some practical tips on how to do it. The third is to discuss how storytelling can promote and advance equity. And then we're going to hear Jess's experience from a survivor's perspective to learn how she got involved in advocacy and speaking and what helped her along the way. So why include survivor stories in your organizational work? Storytelling saves lives. We know that stories are more impactful than statistics every single time. Stories can influence policymakers and funders. In the past several years, there's been a great deal of attention paid on a national level to maternal mortality and morbidity as a result of storytelling. This has resulted in legislation and money flowing into states to improve maternal child health. Storytelling can help survivors heal. Jessica's going to expand a little bit on this later. Storytelling can be used to train healthcare workers to provide better, more people and family-centered care. It can help healthcare workers connect with people on a more empathetic and human level in a system that can be very dehumanizing. Stories can be used to educate consumers and raise awareness. They can be used to provide examples of systemic and institutional failures. And finally, they can center the people that we serve. The people we're serving should be central to everything we do at our maternal child health organizations, and their voices should be heard, uplifted, and included. For the most part, including stories of survivors isn't as easy as just handing over a microphone or a platform. When we ask someone to share their experience, we're asking them to revisit their deepest trauma. One survivor said, sharing is traumatic. We share because we know it could save lives, but we wish we didn't have to. I think when we ask someone to speak about birth or other trauma, we have to acknowledge that it can be difficult. Trauma remains in the person's body, their mind, and in their life. For some people, their trauma is something they're actively dealing with. For some, it's something they've integrated into their life experience. For others, it's buried deep down inside. And for still others, it's a little bit of all of this. The trauma response has easy recall. And what I mean by that is that in many instances, revisiting traumatic events can put a person right back into the same feelings they had when they experienced the initial insult. This can happen when somebody willingly tells their story or when they're triggered unwittingly. For instance, many survivors of traumatic events describe they have memories from the event that ties back to certain sensory experiences they had at the time of the traumatic event. An example would be a person who was a 9/11 responder who remembers the smell of jet fuel when they were at ground zero. That person's trauma response might be activated when they go to an airport to go on vacation and they smell jet fuel, flooding them with memories from their experience of that day. They might even experience a fight, flight, or freeze response. This can happen to survivors when they come speak for us. They might have a challenging time organizing their story, or they might have reactions triggered by reliving their trauma. They also might not have a very easy time of remembering trauma exactly in the order that they experienced it because of the way that trauma is imprinted on our memory. When someone speaks for us, we want it to be a good experience for the speaker, the organization, and the audience. We can help survivors prepare for and deal with the reactions that may arise when they tell their story, and then help them close the door on the experience until they're ready to willingly open it again. So I'm going to go into some different steps involved in the planning process, including pre-event planning, before the event, during the event, and after the event. And I should note that most of this, most of our talk is aimed at when you are meeting with a speaker that might be newer to speaking, not necessarily talking about like professional speakers who have been doing this for a long time, but we know that a lot of maternal child health advocates come from the space of their own experience where they might just be getting into doing speaking. So a lot of the things that we're talking about on a practical level are to help people who are new to telling their story or have never told their story before. So you plan your event and you think you have the right speaker. Here are some ways to set your organization and your speaker up for success in the planning process. The first thing that you should do is to consider your audience and your topic. What are you hoping to achieve? What do you want your audience to learn from the story and from this storyteller? You should schedule time to listen to the person's story as they tell it from beginning to end. And then you're going to decide if the story fits with what your goals are as an organization. There should be a good fit between the story, the storyteller, and the audience receiving it. You should ask, what's the ultimate takeaway? We want the takeaway to be the authentic message being told by the storyteller. Once you've done all of that, the next step is to help the speaker prepare. Do not make them go in blindly. You should meet with them ahead of time and make sure they understand what they're speaking about and the expectations for their participation. Ask them what their goals are and what's important for them to get across. Help them organize themselves to hit the points that are important to them and to you and your organization, but don't try to control the narrative. The storyteller should control the story. We can also help our speakers reduce anxiety by letting them know what to anticipate and what to expect. And some of the steps that we can take to do that would be to introduce them to other panelists or moderators if they're going to be involved in a panel. We could create a run of show for them where we give them a document ahead of time that shows the time and the steps that are going to be, everything that's going to be taking place so they can plan the event out for themselves. We could potentially provide them with questions ahead of time. If we're going to be asking them questions as part of a panel, we can give them to them so they know what to anticipate and expect. And then we also want to test technology with them to make sure that everything works the way it's supposed to. On the day of the event, you're going to show up early. Make sure that these people have time and they feel prepared and feel supported. You're going to test technology again, especially if you're working on a virtual platform. Everything takes longer than you think it's going to, so give yourself time to do that. You want to just practically get phone numbers in case there's any virtual presentation glitches. For this presentation today, we made sure that, Jess and I each had copies of the presentation in case somebody's computer went down. We have ways to reach each other and contact each other. So you want to have multiple copies of your presentation handy. You want to be available to answer any last minute questions, and then check in with the person who's speaking. Ask them, how are you feeling? Do you feel ready? Is there anything I can support you in today? And you should ask that even if they're really experienced speakers. I've had a fair amount of speaking experience, and every time I talk, I get extremely nervous and, question my worthiness in my ability to speak. So even experienced people get nervous when they're talking. So check in with them ahead of time, make sure that they feel like they're supported and they have what they need in order to successfully speak. So once you've held your event and it's been successful, don't just disappear. Don't let the webinar end. Don't just let the person walk out the door. Check and see how they're doing and how they feel like it went. You want to debrief with the speaker, provide them an opportunity to get feedback from you and to give you feedback in things that maybe you could have done better to help facilitate the event. You might want to provide them resources. For several of the events that I've done, I've had mental health counselors on hand and accessible to the speakers that I've worked with to give them somebody professional to debrief with. Or you can facilitate a warm handoff for them to have somebody to talk to for further processing. And then kind of ask them, what are you doing the rest of the day? Who do you have to support you? Just to make sure that they have people to help support them in the aftermath of them telling their story. Thank them. It sounds really basic, right? But thank them for their willingness to re-enter this space and to share it so that others can learn and be helped. And then check in with them again later, in a day or so to see how they're feeling once they've had time to process their experience. I'm going to take a little sip here. So before Jess comes on and talks about her experience, I want to talk a little bit about how storytelling can help advance equity. And I love this quote by Dr. Shalon Irving. She said, "I see inequity wherever it exists. I'm not afraid to call it by name and work hard to eliminate it. I vow to create a better earth." And this quote landed in my inbox when I was working on this presentation, and it was so perfectly timely. And I actually just sat in on her mother's session, Ms. Wanda Irving, and it was so impactful to me. This quote was said by Dr. Shalon Irving. She was an extraordinary woman and mother and daughter who worked to reduce health disparities, but who died after giving birth to her daughter Soleil after being dismissed when she was having health problems after she gave birth. And Dr. Shalon's work has been very impactful to me. So we know we can advance equity through storytelling, and here are some of the ways. Storytelling centers survivors and the people we serve. Stories told by the people who experience them can humanize them, and stories can show the audience the direct impact of their words, their actions, or sometimes their inactions. Storytelling brings inequity into the light. It acknowledges that inequity exists. It validates the experiences that people had. Stories can serve to flatten the healthcare hierarchy. Right now in healthcare, we function where power, knowledge, and resources are held by systems and groups, and patients are the recipients at the bottom where knowledge supposedly flows downward. We need to flatten the hierarchy to put people we serve on a more even footing, where there's a back and forth flow of knowledge and learning, where care is respectful and decision-making is shared, where people are trusted to know what's best for themselves and their families. Storytelling is a way we can take concrete examples of people's experiences, learn from them, integrate them into our lives and practices and the care we provide. Storytelling can be a call to action or can call people in. It can inspire people to use their own privilege and power to advocate and uplift those who have been and are still historically marginalized and intentionally disadvantaged. Storytelling uplifts lived experience as expertise. Like we just discussed in healthcare, the people with the healthcare education and training are held up as experts, and we may be, but we also have to acknowledge that the people we serve are also experts. They're experts in their own bodies, in their own lives, in their own families, and in their own communities. When we uplift stories and listen to survivors, we are acknowledging that we have something to learn from them. So here are some of the considerations you can make in your organization to facilitate storytelling to advance equity. And this is by no means a comprehensive list. First, look at the committee or group planning the event. Are there people with diverse experiences actively included in the planning? Second, don't assume your speaker can or will volunteer. Be upfront about available financial resources and, if possible, advocate for funding for your speakers. This acknowledges that their time and work holds value. Third, who is facilitating or moderating your event? Is there concordance between the learner and moderator and panels and speakers? Include members of the community and peers to lead panels or ensure that the leader is well trained in the issue. Someone who is a member of the community being addressed may ask different, more relevant questions and may bring to the forefront issues that others not part of a community may not have even considered. Finally, make plans to make the event a safe place for authentic sharing. Set expectations through a code of conduct. Have someone moderate and monitor any chat or question and answer session to prevent something like Zoom bombing if it's online, or comments that have only a purpose of being discriminatory, racist, or harassing. Some final considerations that can help advance equity through storytelling are to promote a space that is honest and open. Survivors should be supported, but not censored. They should be able and safe to tell their stories authentically. At times, when people are provided this space, they will share stories that are incredibly painful to them and may be difficult for an audience to hear. They will describe racism, homophobia, ableism, discrimination, disrespect, and flat-out mistreatment that resulted in significant and emotional physical harm or even death. When providing a forum, we need to remember that those in the audience need to hear hard things and that learning about bias and discrimination is not harder than experiencing them. Finally, with our platforms and power, we should amplify organizations that are already doing the work. Storytelling is not new. Equity work is not new. Reproductive justice work is not new. But much of the recent attention and funding are. When deciding to speak on a topic, we should reflect and ask ourselves, why are we talking? Can we support and uplift a community without taking up space and resources? Or can we use our platform to amplify their voices? We should support organizations already doing the work that have people on the ground level and share lived experience and community with the people they serve. So I'm going to turn this over to my partner, Jess, and save all of you from my dreadful voice. And I just want to say to Jess that I'm so grateful to have this platform to share with you, and I'm so proud of you, and you're so brave in sharing your story. So thank you so much for doing that, Jess.
Thanks, Jamie. You're so sweet. As I introduced myself earlier and Jamie introduced me, my name's Jess Montalto. I'm a survivor of postpartum depression, postpartum anxiety, and postpartum OCD after having my son 7 years ago. So in my presentation, I'm just going to be discussing how I became an advocate, the importance to me of sharing my story and struggles, my experience with sharing my story, and why Jamie and I felt like it would be helpful to survivors to share their experience with others. You could go ahead. So it actually took me a really long time to get the help I needed from my PMADs, and it was basically due to the stigma associated with it. I was in denial with what I was going through, and my family was not really, believing me. They thought I was being dramatic or making things up for attention. So once I did receive the help, I was beyond grateful, and I just felt the need that I had to pay it forward, right? Like I didn't want anybody else to go through what I went through. So I actually started advocating in the center where I received treatment. I would go to the support groups, and rather than me giving support, I would give support to others, or getting support, I should say. I would give it to others. And women were pretty much like just shocked and relieved that so many other people are going through the same thing that they're going through. I figured if I showed them how healed I was, they would feel confident that they could be healed too. My goal was basically just to normalize the experience. If they were hearing voices, oh my God, I was hearing voices, you can't sleep at night. Well, here's what I did. I just wanted to really normalize it for everybody. So when a woman's pregnant, everybody tells her how amazing motherhood is, right? And all of the wonderful experiences that go along with it, with bringing a child into this world, but nobody talks about the bad, right? Nobody shares the disappointment and the hardships, the no sleeping, the crying, you don't have your body anymore. Like you kind of lose your identity when you become a mom. So think about this. After listening to how incredible motherhood is for everybody and hearing everybody else's positive experiences, what happens when a woman has a baby and has a negative experience? Maybe there was a birth trauma, or there was no instant bond with the newborn, but now there's this inequity of where expectations don't meet reality. And because of that inequity, that they're expecting, what they were expected isn't what they're going through, women get shame and guilt from it, right? And they're less likely to reach out for help because of that shame and guilt. We could estimate 1 in 7 women will suffer from some sort of PMAD, but it's probably more common than that if you take into account the women that don't want to ask for help because of their shame. Another important factor was the lack of resources that I had when I needed help. So I figured if I was open with my struggles, that people might feel like they could talk to me about struggles that they were having. And that's actually what wound up happening. So I wasn't only able to validate what they were going through, but I was able to give them resources. And, validation and resources are something that could have helped me tremendously during my postpartum. So once I was well out of my treatment, I became a regular at the center. I facilitated support groups. I was a mentor to new moms coming in, and I actually started my own support group. So my former therapist was conducting a continuing ed workshop and asked me if I wanted to tell my story, and I did. I spoke for about an hour, and I was not given any direction on how to speak or what to say, what not to say. So I wasn't that properly prepped, but I think that my therapist was just so proud of me. She didn't seem to care that I went up there and like winged it. But as nerve-wracking as it was super cathartic for me. I felt empowered about being able to talk about my struggles, especially because I was no longer struggling. I was super vulnerable though, right? So the way I look at it is I keep my trauma in a box, and by telling my story, I'm digging that box out, opening it up and showing it to the world. And when I'm done showing it, I need to put it back in the box and store it away. So one of the things that was really hard for me was my story depicts my family in a negative light. So they didn't understand what I was going through at the time, but as Jamie said earlier, like I didn't want to censor myself. So I would add a disclosure in the beginning of my story, saying, that instead of like throwing them under the bus, like my mom says I did, just saying they didn't really know anything, but they're a huge support to me now. So when working with Jamie, things that were definitely helpful was her recommending an outline, because it helped me organize my thoughts. And that was basically the bones of my story. I highlighted the key factors, I added content where it needed it, and I kind of removed things that didn't seem necessary to discuss. But the most important thing, like Jamie said, was the follow-up. By having a debriefing session and following up with me, it actually was able, you're able to put that lid back on the box and safely put it away. And without doing that, I would not be able to, present and speak at as many conferences and workshops as I do. You could go ahead. When it was, like I said, it was important for me to just normalize everything. I felt like I was alone in a room full of people, and nobody should really have to feel that way. So I feel like it's really important for family members of survivors to hear about my suffering and how my family reacted, as long as survivors themselves. I think it could really be a very healing process. And by telling my story so frequently, I'm somewhat desensitized to it, making me less likely to be triggered by other people's stories. So, I'm super lucky that I have a silver lining to my story, but that's not really the case for everyone. But, I feel like rather than surrendering to my trauma, I feel empowered by defeating it. And, the more I share my story, the more people reach out. And, when I was going through my first year, I felt like I had no one, but my story came full circle for me because of how open and informative I am regarding my PMADs. My family are now my biggest support system, and I'm an advocate. As I'm an advocate for women suffering from PMADs, my family members are now an advocate for me. So thank you guys so much. And I think that there's like a few minutes left if anybody has any questions. No.
So this is just our contact information if anybody cares to reach out to us. You can also reach us through the conference app. And then these are just some resources of patient and family advocacy groups. If you're interested in learning more or trying to find organizations where you can pair up with patient and families. And I'm also going to put a shout out if anybody hasn't seen Aftershock yet on Hulu. It's one of the finest pieces I've ever seen on maternal mortality and morbidity, and it really does a fantastic job as a tribute to Shimoni Gibson and Amber Rose Isaac, as told by their partners and their families.
Jamie, somebody asked how your presentations are funded.
So I think that there's a lot of different ways you can look at funding your presentations. You might be able to get grants. You can find partners in your industry to sponsor or provide sponsorships for your conferences or whatever you're hosting, and then see if you can take some of those funds to be able to put them towards your speakers. And then you can also see, if your own organization has any funding or grants available.
I think that's it. Thank you all so much for coming.
Thank you so much for attending.